It's all you.
All right. Thank you so much. Let me get this from the slideshow. All right. Thank you so much for having me this evening. I am Jenn Ford, the manager of community education at the Mental Health Association in Delaware. So, what I'm going to go over tonight is just a very basic introduction that we call Mental Health 101, just with, what it looks like and how you can actually help. And then afterwards, we will have plenty of time for question and answers and having that opportunity to just recognize how important it is that we talk about our mental health because it is something everyone has because we are alive. So, a little bit about Mental Health Association as an organization. We are a nonprofit organization that is statewide. Our one office is in the Community Services Building. Our other office downstate is in the Milford Wellness Village. We offer a variety of programs. We have a peer services team, which is the entity that delivers the certified peer recovery specialist coursework for individuals with lived experience that want to utilize their lived experience to give back and help others. We aren't the organization that does the certification exam. We do all the coursework for individuals to prepare for their certification exam. We also offer the Certified Peer Recovery Specialist coursework and classes in all of the Department of Correction facilities in the state of Delaware. So individuals with lived experience that are currently incarcerated will have a job opportunity when they get out. We provide peer mentors for mental health court, and that is for individuals that have had law enforcement involvement and are facing charges, and their charges are in response to their mental health condition or substance use condition as well. We offer peer internships, and that is a way for individuals with lived experience to receive a position where they are able to work in the peer field while going through the training classes to receive their peer recovery specialist. And they get direct supervision so they are able to be prepared to enter the workforce and to sit for their exam as well. We offer a variety of community helper suicide prevention trainings that are all evidence based, and they all come with a certificate that is valid for 3 years. We have staff that are trainers for these programs. We have ASSIST, which is Applied Suicide Intervention Skills Training. That is a 2-day training. We also offer Safe Talk, which is a 4-hour half-day training. Those two are from Living Works. QPR is Question, Persuade, Refer. That is a 1 hour to 90 minutes suicide prevention training that helps to really identify signs that someone might be thinking about suicide, how you actually ask that question to see if they are thinking about suicide, how you provide resources, persuading that person to stay safe for now, and connecting them with the appropriate level of care. We provide mental health first aid and youth mental health first aid. Those have in-person and virtual options. They are evidence-based trainings from the National Council on Mental Well-being. We provide Lifelines. That is a suicide prevention curriculum that is delivered in middle schools and high schools in the state of Delaware. We have a staff member who manages National Depression Screening Day, which is October 9th. We as an organization provide National Depression Day screeners to any organizations or businesses or faith communities that would want screeners to come out to their site to provide this free service. And depending on how someone's screening results come out, we also have the ability to help make those direct connections if that individual wanted referrals to seek behavioral health care. We offer mental health education and awareness training. And the way we do that is providing 4 annual conferences a year: the Empowering Community Wellness Symposium, which just occurred in March, and it will be held March 23rd, 2027. We just had our Peer Support Summit May 14th of this year. I don't believe they have set the 2027 date yet. Our Military and Veterans Mental Health Summit will be September 15th at the DuPont Country Club, and this year's theme is to support military veterans and their families and their caregivers and the unique needs they have. We also provide a higher education suicide prevention conference that happens annually in the fall, and the title of it is You Matter to Delaware. This year's conference will be November 4th at Wilmington University's Newcastle Campus Conference Center, and it will be a half-day option. We're able to offer a variety of workshops and trainings. So we have a Master Your Stress workshop, a self-care workshop that has hands-on activities that are really geared utilizing SAMHSA's 8 dimensions of wellness. We do the Mental Health 101, which is what I'm doing tonight for you. And then we offer 11 wellness groups a month, and our wellness groups are led by individuals with lived experience, and they are healthy and well in their recovery, and they want to support and give back. So we have a check-in wellness group. We have one for individuals that, could be experiencing depression and anxiety, which are 2 of the most common mental health conditions. We have a disability and chronic illness group for individuals that can be living with a variety of different conditions. We have a monthly journaling for joy group. We have one for the LGBTQ plus community, a men's wellness group that is specifically designed to, address men's mental health. We have a survivors of suicide loss group, and then we also have a group for individuals that do experience hearing voices. So when we talk about mental health, it's important that we remember mental health is something everyone has simply because we are alive. And we want to remember that our mental health and our physical health are directly connected, and that it's important that everyone has some basic understanding about what are the things we need to do to keep our whole body healthy and well, and the importance of doing the things we need to do to stay healthy and well and to stay resilient. And also to acknowledge that we can have changes and things that can happen and we can experience that can impact both our physical health and our mental health. And the systems for the healthcare systems for our physical health and our mental health can often be a little bit complicated to navigate. I'm seeing some heads shaking. Yes, they can definitely be a little difficult to navigate, and just not always knowing who are those trusted people that you can ask, and being sure that when we ask questions, we are treated with respect and dignity, and that we are not viewed as, oh, that is a stupid question. because there's no such thing as a dumb question. And we at the Mental Health Association really work on helping to empower individuals to be able to advocate for their health and to recognize when they feel they might not be treated the way they should be treated with respect and dignity and care and concern. So this slide kind of just shows a little bit around what are some of the general health practices, how we want to be sure for our physical health, we are doing preventive things. We are taking care of the things we need to do to remain safe. We will do what we have to do. If we have something come up with our physical health, we will go to the doctor, follow what we need to, whatever that prescribed course of treatment is going to be, we're going to do that so we can move into recovery because we want to avoid those crisis emergency situations. We want to prevent that. That doesn't always happen in every situation, but this is the ideal and the goal. It is the same with our mental health. We want to do things to protect our mental well-being. We want to practice wellness. We want to practice healthy, appropriate self-care so that we can keep our cup full and we can keep showing up in all aspects of our life. If we have a challenge with our mental health, because that can happen, and it is incredibly common. 1 out of 5 adults in a year will experience a challenge with their mental health. We want to be sure that we have the skills and the knowledge to advocate for ourselves, to be able to do the things we do and that are needed for us to seek that recovery to prevent crisis situations. So stress is a very normal part of life. I feel like, we can all acknowledge that there's been stressful times. And it's important that we remember that and also that we think about what are ways that stress affects you in your daily life. How do you know that you're having a stressful time? What are the signs that your body gives you that you're having a stressful time? Anybody want to share?
Heart racing, sweating,
Okay.
just being uncomfortable. Very, yeah.
Yeah.
Migraine.
Migraine. Yeah. And those are all very common physical responses to stress. I know I won't sleep as well. I will have like dreams that are just like my cat is driving the car. That is never going to happen. I mean, I hope that's never going to happen. Just things will kind of play out in my head, or if I wake up, I can't go back to sleep. So just being mindful and knowing how stress shows up physically in our body is a key to being able to help manage our stress. Stress has a lot of effects on the body, on all of our body organs. And I am not going to read the whole slide, but this slide shows how it affects so many of our different body systems, and also recognizing that we are all individuals. So it isn't going to impact everybody the same way. But when you look at this, some of these things, are pretty bad and are going to feel very uncomfortable. Upset stomach, joint pain,
Heart
sup-
attack.
yeah, suppressing our immune system. I know that there have been different studies around, the impact of a chronic stress on the cardiovascular system, how it increases the risk of heart attacks. That's huge. So the next couple slides, and I do not read through them because we're all adults and that would be incredibly boring, okay? But the next couple slides really just go over some of the most common mental health conditions and how they can show up. So, what are some of the symptoms that someone who lives with depression might experience and feel? And then what are the signs that we as caregivers or individuals that interact with someone living with depression might see? And depression is one of the most common mental health conditions. And to receive a diagnosis of clinical depression, someone has to experience the symptoms for more than a 2-week period, and there has to be some thought of suicidal ideations. Now, there doesn't have to be, does not have to be that active plan where someone is suicidal at that moment, but those may be passive thoughts like, that wouldn't matter if I wasn't here anymore. That is part of receiving a diagnosis of clinical depression. So it can look like that sadness, anxiety, guilt, mood swings, just that heaviness, that helplessness, hopelessness. This is never going to get better. The individual experienced depression can feel overwhelmed by worry and self-criticism, self-blame, that pessimism, so negative Nancy always. They can be more indecisive. What we might see on the outside, we might see the withdrawal, crying spells, neglecting responsibilities, losing motivation, losing interest in things that they previously really enjoyed. So that could be loss of you know, their appearance, how they show up. There can be physical signs that can occur with depression as well. Depression can occur in periods where a person has something happen, so it is more situational, or depression can be more of a chronic condition. Depression responds very, very well to treatment, which typically will be medication, talk therapy, perhaps groups. Looking at, some of the differences with depression and clinical depression. So we may say that, someone is feeling depressed. That can be those feelings of sadness, those feelings of hopelessness and losing interest. That can be brought on by a stressful event. It can be situational. Clinical depression is a bit more serious. Clinical depression is more than feeling blue. Anxiety. All right. Everybody worries. Can we all agree with that? Everybody worries. Yeah. Yeah, we all worry. There are things that cause us to worry or to feel anxious or to feel, stressed or concerned about something. Worry And that feeling of anxiety can keep us safe sometimes. You can, I know driving on 95, the 2 days a week that I do that, yes, and that causes me definite anxiety. But I also know because of that, I'm super mindful of what lane I need to be in and when I need to put my turning signal on, and I am one of those drivers. And that keeps me safe. Worry that results in impairment and the inability to enjoy our daily activities, our daily life, the things that, they say the live, love, laugh. That was Luna. Sorry. That is when it really is time to seek professional help. When the feelings of worry are overwhelming and having a negative impact where a person is just not enjoying what they usually did enjoy. Anxiety can have a variety of physical symptoms impacting many of our body systems, and then the psychological symptoms as well. A very unrealistic, excessive worry or fear that you overplay in your head over and over again. The mind racing because that is what's happening and things are just so awful. It can look like, feeling just very restless and very unsettled, like that constant chronic butterflies in the stomach. It's always going, going, going. That can be something. A person can avoid certain situations. They can have obsessive compulsive behaviors. They can have phobias. Experiencing extreme distress in social situations. Anxiety is incredibly common. More than 1 out of every 6 adults in a year will be diagnosed with an anxiety disorder. The number is probably much higher that actually live with anxiety because that's just the amount of people that actually go in to seek that professional care. Bipolar disorder is often referred to as being on a roller coaster, where an individual will experience some very extreme mood shifts, where there can be mania, which is very, very up and high. And that is where the individual is experiencing feelings of euphoria, and there's a lot of extreme risk-taking behavior. So it can look like maxing out every single credit card, using substances, engaging in risky sexual behavior, just doing things that could be very dangerous, but not seeing the danger in it. And then the other side is the very, very low depression. There's a lot of different thoughts that someone living with bipolar disorder can have. Racing thoughts. This may look like the individual who just talks a million miles an hour and only a couple of the words are actually making any sense. They might have sleep disturbance. So you might hear something like, oh, I haven't slept in 4 days and I've painted all the rooms in my house and I'm doing this and that. And, you know, I don't sleep for one night, 8 hours. I can't function. So, just a lot of different things that we might hear. They might report needing less sleep. They might have, the swings of either so much energy or no energy at all. It's more up and down. can also look like the person that can get incredibly angry over something that, you know, I might view as, oh, I didn't mean to upset you. Like I only asked to borrow a pen. That shouldn't have garnered the reaction that I got and such. And then again, like all of the other mental health conditions, there are the physical symptoms that impact our body systems as well. Okay. PTSD is commonly, when we talk about PTSD, we really want to remember that it is not just veterans that experience PTSD. That is usually the first thing that kind of comes into our minds when we think of post-traumatic stress disorder.
I was going to ask you if you had had a lot of interaction because there's conversation among survivors that cancer survivors have PTSD from being diagnosed. I
Yeah.
just wondered if you had or interacted or experienced.
I haven't, but that Meredith does not surprise me. And the reason is because as individuals, we all experience events in life different. And for some, and that's how trauma is. I use the example of a car accident. You can have two people that are, in the same car and they have a car accident. And it's not terrible. No one goes to the hospital, but the car definitely has to go in and get fixed. One person can just be, nah, it's fine. The car's getting fixed. No big deal. Pain that I have to have a rental, but it's fine. The other individual can really experience that as a traumatic event because for them, they have defined it as a traumatic event. It causes an impact on all aspects of their life that lasts for more than 4 weeks. And that's why I say it does not surprise me because when you have someone you love and care about and they receive a diagnosis of breast cancer, that's got to be terrifying. Absolutely terrifying. And for a child, that's terrifying, the thought that they might lose a parent. Yeah, yeah. So we want to remember that I'm so sorry, my cat is being very bad. Did you see that, Stephanie? Yeah, no. She like jumped to bite my hand. I think she's like a little mad at me right now. I don't know why. Um, so I think it's just important that we remember that PTSD is going to show up different in individuals depending on what they've experienced and also depending on the age of the individual and such. Substance use disorder does rarely will show up by itself. It is very common for individuals that live with depression or anxiety to self-medicate with a substance. And then that can also result in a co-occurring disorder because they are living with anxiety and substance use disorder because they've misused whatever substance to manage their symptoms on their own. And substance use disorder is very, very prevalent. It has lasting impacts on that individual and also on their loved ones. And depending on the substance, getting treatment. There's lots of options out there, but it can be really, really hard. And I speak from an experience. I have a loved one that lives with a substance use disorder. So it can be really challenging because you can take a horse to water, but you can't make them drink. This slide simply shows a couple other mental health conditions that, can be diagnosed as mental health disorders. There's a lot, and the point of this slide is just to be sure that, just raising that awareness of what these disorders are and such. Okay. Recovery. Recovery is not linear. It does not look the same for every person, but recovery is absolutely always possible. It can be really challenging for an individual because there can be bumps in the road. And when someone lives with a diagnosis, it's important that they get the support from those that love and care about them. So it's going to look like that family, friends, caregivers, that personal network, but also their work friends too. Okay. 988 is the nationwide suicide crisis lifeline. This number can be called or texted 24 hours a day, 7 days a week, 365 days a year. In the state of Delaware, it is answered by Contact Lifeline. If all of Contact Lifeline's listeners are busy, they are on the phone, it bounces to Delaware Substance Abuse and Mental Health's Crisis Intervention Services. They have been approved as a lifeline provider as well. So we in our state have an 84%, no, it's 82, excuse me, an 82%, answer rate within 2 minutes. That's the same for the national average. That's pretty good. That is really pretty good. 988 is able to help support someone in a mental health crisis and a substance use crisis as long as there is not an immediate medical need. Now, 988 is also a number where, and they don't really advertise it as such, but it is a place where people can call or text just to talk to somebody, to have that empathetic listener who is trained and who can listen and who can also provide resources for a variety of different things. Because it can be really hard to try to navigate, depending on what someone's health insurance is, how to find behavioral health services. MHA has a resource, an information and referral service. Now, we don't have a separate number for it, but if someone calls and says, I am looking for a therapist, how do I find one? The first thing we ask that individual is, do you have health insurance? If they do not have health insurance, then I ask, are you a Delaware resident? Do you have residency in the state that can be verified? And then I walk them through how that process is to obtain state health insurance and where they need to go, what they need to take to do so, and then what is the next step to be able to get behavioral health care. If they have private insurance, that is going to be, look on the back of your card, because most of us that have private insurance There's a number that may say for behavioral health, it may say for mental health, or it might just be your customer service number or website. And you're going to want to be sure that the providers are in your plan for coverage. I also will talk with the person about what's going on, that they want to seek behavioral health care, because sometimes that really determines what that next step is and what that answer really is, what is going to be best for them in that instance. We at MHA are not able to recommend or endorse any providers. Now, there are a couple very specific needs that there just aren't a lot of specialists that cover those specific needs in the state. That if that was what a caller was asking about, I am going to give them those, practice websites, information intake people, because if their need is so specific, there aren't always a lot of options and such. One of the big frustrations is that there's a lot of providers that are not taking new patients at the moment, or they are, but it's in 3 months. And that is not always helpful, especially when someone has recognized that they are at a place where they want to seek care. Utilizing another provider. So if someone has a primary care provider, that sometimes can also be an in for seeking care. And getting in a little faster is not a guarantee, though. So, which, again, that can be really hard. Any questions?
I am grateful that the suicide hotline exists. When I was 15, my older brother took his life, and there was nothing, absolutely nothing, no support for him and no support for the family. And so I'm grateful that the things that are in place now exist.
I'm so sorry for your loss.
Thank you.
I can share that MHA is also the organization that houses the Delaware Suicide Prevention Coalition. It is a legislatively mandated group. We meet monthly, the third Monday of every month at 10 a.m. We do switch the days a little bit in January and February, because we have those 2 Monday holidays that always seem to be that Monday.
Right.
And that is a collective of people throughout the state that are really dedicated and committed to raising the awareness to prevention, intervention, and postvention, to recognizing that Delaware, having lost over 100 individuals last year to suicide, that's too many.
Mhm.
What was the name of that coalition?
Delaware Suicide Prevention Coalition.
Thank you. I work for Contact Lifeline, but I hadn't heard of that.
Oh, Dr. Cousin is on it.
Yeah, Jackie.
Yeah. So we, meet monthly. We usually have someone that will share a little bit about their program, what they're doing. Sometimes it is outside specialists that come in. Like, I'm trying to get, Maryland has a very specific, they have their Office of Suicide Prevention is pretty robust. and they have someone that really just works on youth, so the under 18 group, and we're trying to get them to come speak. Delaware does not have an office of suicide prevention yet. They have the office and they have the job posting, but that's position has not been filled yet. So we were the last state to get such an office.
Very much needed.
Absolutely. Yeah, absolutely. Any other questions or thoughts or anything I can do for anybody?
I'm going to end this recording just in case anybody doesn't want it
Want it
recorded.
recorded.
You're
Yeah.
right.
Yeah.